My name is JP Canner. I'm the Chief Scientific Officer and Clinical Laboratory Director at Gravity Diagnostics. Gravity's mission is to empower individuals to take charge of their healthcare destiny. And so really we were founded with our values of care, compliance, and confidence. And so this is interwoven with everything that we do at Gravity. We do try to make sure that the results we're providing here, the provider can have the confidence in order to properly treat their patient. At Gravity Diagnostics, we offer a wide range of testing services. And so these would include things such as routine blood tests, such as clinical chemistry. We also offer genetic testing in terms of pharmacogenetic testing. So this is looking how an individual may respond to certain medications. We also offer a host of infectious disease testing. So these include molecular-based testing for chlamydia, gonorrhea, as well as serology-based testing for HIV and hepatitis C. But the majority of our patients are being treated for substance use disorder. So we do primarily urine drug testing through clinical toxicology. One of the things that we realized being in Northern Kentucky is it's always been an epicenter for the opioid epidemic. And one of the aspects of the opioid epidemic has been kind of the evolving nature of drug use patterns within these individuals. And so, what started off as kind of abuse of prescription opioids, then turned into heroin, then turned into fentanyl. And now what we're seeing is considered kind of the fourth wave of this epidemic and kind of the co-use of multiple different drugs in these individuals. And what we recently added to our menu is the xylazine, which is the animal tranquilizer. And so, once again, looking at this regional pattern in our Northern Kentucky region, we're seeing 80% of our fentanyl positive samples contain xylazine. And this is almost double what we see with our internal data for everywhere else within the nation. And so it really is important for us to be able to then provide this information back to our clients in order for them to tailor their treatments for each individual patient population. And so we have a unique aspect where we provide what are called GRAV reports, where we have regional information about drug use trends, as well as supplement that with what they're seeing within their own patient populations. We're fortunate enough to be partnered with Waters in terms of our clinical toxicology testing. And so, we've gone through a pretty explosive growth over the past 2 years in that service line. And so Waters has been there with us, and they've been helping make sure our instruments are running properly, as well as one of the things that we benefit from having the TQS micros with is kind of their smaller footprint. And so we're able to kind of add multiple systems and not have to, acquire a huge amount of space. With Waters, they offer a very comprehensive service package. And so for our facility, we actually have one of their service technicians on site all the time, as well as on call other service technicians if needed. Additionally, one of the benefits we have is our own supply locker. And so, if we have a part go down, we're able to replace it within that day and not have to worry about getting supplies from anywhere else. So they've been extremely helpful, whether that is adding new methodologies, adding new instrumentation, or even, the service. And so, with our main urine toxicology comprehensive menu, we're looking at over 90 analytes per single injection. And so this is occurring within less than 6 minutes. And so really the robustness of this system allows us to be able to have the capacity in order to kind of expand our services. And, unfortunately within our client base, they're also seeing more patients. And so, being able to maintain our growth to match their growth is really important. I think for Gravity, what's next is going to be kind of leveraging the data we're generating and be able to kind of, look at trends within the regional analysis for kind of different drug use patterns with our clinical toxicology data. And then really, as this fourth wave evolves and as the drug use trends keep evolving, making sure that we're on the forefront in order to provide the best menu options for our clients, as well as allow them to make the best treatment decisions for their patients.